Hello, my name is Dr. Dewan S. Raja. Today I will discuss about Sturge-Weber Syndrome. This is a rare neurological and vascular illness, also known as encephalo-trigeminal angiomatosis, because the skin lesions are around the distribution of the trigeminal nerve, mostly affect the blood vessels in the skin, mostly in the head and neck region, but other skin may also be affected, and also the brain. So head and neck skin and the brain, other part of the body skin may be affected. Usually this problem is present at birth. What is the etiology or cause? A somatic single nucleotide missense mutation in GNAQ, the alpha subunit of heterotrimeric transmembrane signaling protein, which accounts for the bulk of port wine stain cases, including the link to Sturge-Weber syndrome, is to blame. So it is a mutation during the embryonic life, somatic mutation and genetic mutation in the gene GNAQ. Okay, so Sturge-Weber syndrome salient traits include nevus flammeus or port wine birthmark, neurological involvement, epilepsy, glaucoma, that is increased intraocular pressure. Neurological involvement, it may involve the blood vessels of the brain and also the other part of nervous system. Glaucoma, dental and gingival condition, other medical conditions such as behavioral and cognitive disorder by involving the cerebral cortex as well as the limbic system, vascular disturbance there, endocrine imbalance, headache, maybe migraine, weakness and paralysis of one side of the body, hemiparesis, maybe hemiplegia. So these are the salient trait may be associated with Sturge-Weber syndrome. So it is a neurological vascular illness. It starts as a mutation during the embryonic life. So if you look at the image here, this is the port wine nevus flammeus of the malar area. This is the distribution of the maxillary division of trigeminal nerve. Okay, here both the maxillary division of trigeminal nerve, mandibular division of trigeminal nerve, the lip, the gingiva is also affected, plus the ophthalmic division of trigeminal nerve is also affected. So this may be more severe, may be associated with Sturge-Weber syndrome. This may be just a birthmark. Okay, so this may happen. So not all port wine stain will be Sturge-Weber syndrome, but Sturge-Weber syndrome may be associated with port wine stain. So what are the features? Port wine birthmark, nevus flammeus, the appearance of a big flat reddish purple birthmark on the face, usually along the ophthalmic division of the trigeminal nerve, forehead, upper eyelid, around the eyes, but it may be the maxillary division of trigeminal nerve, maybe the mandibular division of trigeminal nerve. This is the ophthalmic division of trigeminal nerve, is one of the most distinguishing characteristic of Sturge-Weber syndrome. Birthmarks are frequently present, and as people age, they may get darker and more noticeable. Anomalies in the brain, angiomas, which are vascular abnormalities that can cause a variety of neurological symptoms. Sturge-Weber syndrome can occur in the brain. This may include intellectual impairment, motor weakness, developmental delay, epileptic seizure. Individual differences exist in the degree and then intensity of the neurological involvement. Someone may have very mild symptom. Someone just have the birthmark, no other problem. Someone may have severe problem of the brain. Glaucoma, there is increased intraocular pressure, and angiomatosis of the eye, especially the angiomatosis of the conjunctiva, the sclera, the choroid, the retina. The disorder can affect the eye and cause increased intraocular pressure, which can result in glaucoma and angiomatosis of the conjunctiva, choroid, and retina. Other problem associated with Sturge-Weber syndrome may be with oral gingival hemangioma that may involve the soft palate, may involve the gingiva, and may cause overcrowding of the teeth and tooth fall and more chance of decay in the teeth. Okay, here Sturge-Weber syndrome, we are seeing the tram line calcification because of the involvement of the meninges, the leptomeninges, as well as the blood vessel over the brain will get the tram line calcification arrows like this. Sturge-Weber syndrome, unilateral vascular involvement of the palate. This is soft palate, this is hard palate here. It may involve the gingiva, may involve the skin of the face, as well as the upper lip. Okay, here we are looking at the Sturge-Weber syndrome characterized by unilateral cavernous hemangiomas on the face and neck of a 35-year-old male. Note the unilateral soft, easily bleeding gingival enlargement with high vascularization of the affected site. It is mostly unilateral, but it may be bilateral on rare occasion. This is the problem on the gingiva, so it is prone to bleed. Okay, this is port wine stain on the forehead here by the ophthalmic division of trigeminal nerve, that this person, he has normal lifespan and he was the last leader of Soviet Union, no intellectual problem, no behavioral problem, no hemiparesis. This is just a birthmark. In some individual, it may be associated with Sturge-Weber syndrome, but it is only a percentage, not all the port wine stain. All the port wine stain is not associated with Sturge-Weber syndrome. Only a few percentage, maybe 7 to 8 to 10%. It is believed that aberrant blood vessel, vascular changes, vessels are dilated during prenatal development is the root cause of Sturge-Weber syndrome. The majority of the cases are sporadic and not hereditary. Treatment: Sturge-Weber syndrome. Treatment focuses on treating the patient's unique symptom and problem. This could require using drugs to treat glaucoma to decrease intraocular pressure. Seizure, we need anticonvulsant drug. Other medical conditions will manage accordingly. Some people could need neurosurgical procedures, particularly in case of severe glaucoma. We need the ophthalmologic support. We need surgical procedure for glaucoma. We may need neurosurgical problem for the big vascular change inside the cranial cavity. We may need laser therapy also. Okay. So it is a multi-specialist approach: ophthalmologist, neurosurgeon, dentist. So a lot of physicians may be involved. Prognosis of Sturge-Weber syndrome. The best treatment and assistance for people with Sturge-Weber syndrome on an early diagnosis and a multidisciplinary strategy combining neurologists, ophthalmologists, and other experts. Depending on how severe these symptoms are and how well they respond to treatment, a person's prognosis and life expectancy might vary greatly. Okay, so someone may die early, someone may have normal lifespan with minimum or no problem and no severity of the Sturge-Weber syndrome traits. And that's all about the Sturge-Weber syndrome. If you have any question, please feel free to ask me. Please share the information with your friends and please subscribe my channel. Have a nice, wonderful and blessed day. Bye now.